discussion is the current trends in the management of hemorrhoidal disease. And most of the times these patients, they have different opinions by so many general practitioners before they finally come to the final treatment by the second floor. But before they come to the final treatment, there is an area of management, and that is the medical management of this particular problem. By and large, the international forums where people do discuss proctology and what's the problems, hemorrhoid is everyone's problem. It's everyone's problem. So they don't take it as a disease itself. It's the symptomatology which brings this problem to the doctors. So everybody, all of us, at a certain age, at a certain period of their life, they will have one or the other form of the hemorrhoids. And I would always talk about this way, that it's a price that the human being is paying for its upright posture. It's a consequence of our upright posture. Most of the times, people at a certain age of their life, and they say that after the age of 50, every individual will have one or the other form of this particular problem. So actually not a disease, but a mechanical problem which we face due to upright posture. The gravity effect. The gravity effect. So the common problem, as you can see in this slide, that up to 10% of the total population is affected by hemorrhoids, and 500 million new cases of hemorrhoidal disease are annually reported in Pakistan. The problem becomes difficult with the people. They don't like to share their problem with the family in the first place, and later on, even if they visit the doctors, they are reluctant to be examined by the doctors, and they just want a relief without examination and without being proper schooled. So this is something where we need to learn a few things, few hard facts about the problem, which I discussed in the later part of the presentation. Awareness and right treatment of the disease in general population is very important. So that message, if at all there is any message in this presentation, that is about the medical management of these hemorrhoidal patients, though I'm a surgeon, but I'm still talking about that the majority of the people can still be managed by the proper dietary advice, regularity of life, eating habits, physical activities, and use of certain medicines. Like constipation, low fiber diet, and sedentary lifestyle, which are the documented risk factors uncommon in Pakistan. Now, sedentary factor and constipation, they are the factors which are agreed upon by all the big names who deal with hemorrhoidal disease in this part of the world. That is, I'm talking about the Southeast Asia and Asian populations. But this low fiber diet, that is becoming a little controversial, because people used to say that high fiber diet is going to protect from hemorrhoids and you should take plenty of vegetables and fruits. But recently, the conferences which I've attended, they are shifting towards not giving a bulk, not giving bulky stools. So avoiding this high fiber diets is one factor which can help you prevent this problem. Now, this is something which is what you see. Why do we develop hemorrhoids? And if we develop hemorrhoids, what do we see when we do an examination? Please don't try to deal with any patient who has ever come to you with a bleeding per rectum without examination. You have to do the examination, you have to do the digital rectal examination, and you have to do the proctoscopy to have a look at this kind of picture, because there you can see hemorrhoids. You have to do, because It's not only the hemorrhoids which are giving you bleeding for rectum, but there can be other situations which can be dangerous for the patient, and especially in cases if you prolong the chronicity of a malignancy. If you keep on sitting on this sinister disease, that is not going to add any benefit to the patient's health in future days. So we should always be very careful when we are dealing with these bleeding PR patients. I would request all of my colleagues who are sitting in front of me that please try to go for a proper examination of the patients whosoever have come to you with a history of bleeding per rectum, because by doing the proper examination, you can actually see the severity of the problem, and once you have seen the severity of the problem, only then you can treat it. They say the first step towards the solution of a problem is its identification. So identification of this particular condition is not possible unless and until you do the proper examination. And moreover that, besides hemorrhoids, you can also look for certain other pathologies which can be serious and can have serious consequences on the life of the patient. So please try to examine all these patients whensoever they come to you with a history of bleeding PR. We must examine them, do a digital rectal examination, and do a proctoscopy and try to state the disease and what kind of the problem is, because the treatment strategy will be defined, will be decided on the basis of the stage of the disease. Now coming to the treatment objectives of the hemorrhoids, you have two objectives. Objective number one is relief of the hemorrhoidal signs and symptoms. So currently whatsoever the patient is suffering from, you have to bring him out of that scenario, and that scenario most of the times is bleeding, because a pure hemorrhoid should not give rise to any kind of pain. Whenever there is an element of pain added to the problem or the symptomatology of the patient, you should think of the possibility of some other problem. Many a times the other problem can be a fissure added to hemorrhoids. Later stages of the hemorrhoids, which are easily diagnosable in the history of the patient, you can have a complication of hemorrhoids in the form of a thrombus or a gangrene of the hemorrhoid. But they are the problems associated with later stages of the disease. But in early stage of the disease, hemorrhoid should never be painful. Whenever the patient complains of bleeding PR with severe pain, you should think of some added problem, and that added problem most of the times is a fissure. Pure hemorrhoids are not painful. So first thing is to consider the patient's relief, which is mostly in the forms of bleeding, and if there is something else added to it in the form of pain, then it's a fissure which needs treatment according to whether it's acute or chronic. And the other thing is, once you have dealt with the problem of the patient, you have to work on the protection against recurrence, because these venous diseases, they are notorious. They bounce back, they do come back, even if you get treatment for venous disorders, even in the form of varicose veins or in the form of hemorrhoids, you're likely to have it, because the factors which are responsible for this problem, they will still be there. You have to improve in your lifestyle, you have to bring about certain changes in your life habits, and you have to work on avoidance of the constipation. So there are so many things which you have to do. You have to give up your bad habits. People have developed bad habits of sitting on the course for a longer time, using magazines, using newspapers, using mobile phones. So this is not a good thing to do. This is a very bad practice which can lead to problems in your life at a later stage. So one should not spend more than 5 minutes in the toilet. That is what the general recommendations by the proctologist is. That stop using any kind of magazine, newspaper, or mobile phone in the toilets, because that will make you sit there for a long time, and if you sit there for a long time, you are likely to develop the problems. So better avoid all these things. So in order to prevent the recurrence of the disease, you have to follow certain instructions, because it's not only going to be a one-time job. One-time job is a relief, not a treatment. The treatment in the longer run would be, please avoid all the wrong things which can work as a pathological factor for this particular condition. When we talk of the treatment, I'm not talking which is covered under one umbrella, and that is the medical management. So this can be a topical treatment and a veno-active drugs. So when we talk of the topical treatments, which is prescribed by many doctors and it's preferred by the patients as well, because they find it convenient that they can get the treatment without any kind of surgical intervention or procedural intervention. Now, the message about these topical ointment is, I'm not saying that they're not going to give you any relief. They will give you any relief. The patient will praise you as a doctor, but that is not around. That is a very, very transient period, or a deceptive period, where the patient thinks he gets better. But the message is they provide short-term relief from discomfort, but they don't reverse the underlying physiological changes associated with hemorrhoids. So the problem is still there. You've just given medicine, paracetamol for headache. But that, you should always know that it is not going to solve the problem. The problem is going to be there. So you have to address the problem, the underlying problem, the etiological factors behind the symptomatology. And that thing is going to come from the medical treatment, which is Jasmine FF. This APF is one of the veno-active formulation, which is considered, which is the treatment, which is the treatment for the prevention of recurrence and the relief of the symptomatology of the patient. This MPFF stands for micronized purified flavonoid fraction. So 95% of the drug is Dosman, but in order to make its efficacy and absorption to the best, this is micronized. That means the size of the molecules is reduced to a level from where the maximum drug is absorbed. And the main function is also given by the flavonoids, which is an extract from the citrus fruit, which is not even taken as a drug. So this is not actually a drug the way people consider drugs like antibiotics or other drugs with side effects and all that. This is something which is extract of the citrus fruit. That's what it is. So you can comfortably and reliably prescribe it to patients, even if you have to prescribe it for a longer time. Now, this drug is a veno-active drug. It works on the stability of the walls of the vessels. So the laxity of the wall, as you find in varicose veins, and the cushions which enlarge due to laxity of the venous wall. This is reversed by the use of this drug, as this drug acts on the walls of the vessels and enhances the tone of the vessels. So you can get a better result, better return of the blood from these vessels into the circulation. So the benefit of the drug is achieved by enhanced tonicity of the vascular walls. Now, there are different levels of a medical recommendation. There are different levels of a medical recommendation. I quoted like the way we our weather longevity comes, because there are so many shahadas involved from everywhere, but the final words come from Mufti Ibrahim. So similarly, there are certain recommendations for the medical recommendations. There are certain levels of their reliability. So this Cochrane library is one of the highest raised. You can have level 1 recommendation from there. So this statement that these veno-active drugs do support enhancing the tonicity of the vessel, it has come from this level of recognition. This is a level 1 accreditation, which is published in different journals after getting out a meta-analysis studies on different types of preparations and the scientific analysis of the outcome. So this is a level 1 recommendation which says the study was conducted to evaluate the efficacy of veno-active drug in alleviating the signs, symptoms and severity in hemorrhoidal disease and verify their effect post-hemorrhoidectomy. So an overall picture was evaluated, and the overall picture was that what was the effect of this drug on the patient's symptoms who is suffering from hemorrhoidal disease, and at the same time, even after post-hemorrhoidectomy, what benefits could be achieved by the use of these drugs. So all these studies, which were carried out at a very high levels, they came up with suggestions that the outcome of their study, which revealed, you can see the efficacy of the drug, which is shown in this picture. There are different parameters seen in this picture. That is common problems of hemorrhoids. Here you can see the bleeding, pain, pruritus, and discharge of leakage. They are the common problems which the patients are suffering of, and they all were individually analyzed, and the analysis that showed that the bleeding was patient got benefited in 84% of the patients, pain in about 79%, pruritus in about 77%, and a discharge of leakage, that is about 75%. So overall, what you can see in this picture, that the 70 to 80% of the patients benefited once the drug's effect was analyzed. Acute bleeding during first and second grade, that's another there. So you can see this is, if you look at the patient who's taking this medicine, say day 3, 80% of them, they have a relief of acute bleeding. The disease can be acute, the disease can be chronic, so acute is considered when the patient starts bleeding. So if we treat these patients with this drug, you can see, according to the studies, that they have 80% of them, they are benefited with the use of 3 days. But here, if you use it for 7 days, the 94% of the patients, they get benefit and their bleeding stops. Again, anecdotal pain, you can see if you use the placebo, the graphs are here, but if you use Taflon 500 mg, then you can see this use of 7 days, and the patient's symptomology is better controlled and controlled in most of the patients. The other factor, the treatment objective, one was to treat the symptoms, the second one was to prevent the recurrence of the disease. So here you can see the benefit of this drug in the use of prevention of recurrence of the disease, where you can see that -72, that is as compared to 2.1%. Here the recurrence of the disease is about 0.6%. So both objectives of medical management can comfortably be met with the use of the efficacious use or the recommended use of this particular drugs, which falls into the category of vasoactive or phlebotomics. Dosmin is recognized as the pharmacological treatment of reference in the medical management of hemorrhoids. That's what the message is. This is how we're going to use it. If at all there's any patient who's bleeding, please don't skip the examination part. That is my message to all of you. Do the correct examination and preferably do the bronchoscopy as well. This is how I'm going to use the drugs. That's day 1, 2, 3, and 4. That is 6 per day for 4 days and 4 per day for 3 days. Maintenance treatment to prevent relapses is for 2 per day for at least 2 months. The same recommendation for the drug is that it can safely be continued for 3 months. After 3 months, you should evaluate the patient for any side effects of the patient which is not there. So if it's not there, you can carry on for 6 months. The 2 tablets a day, that treatment can be carried out for 6 months with break at 3 months for certain evaluation of the patient. Otherwise, it's a safe drug. And I thank you very much to all of you for a very patient listening.